Immunotherapy has been a clear improvement in cancer in general for the past years, but in MPNs we still lack clear immune therapies appropriate, despite interferon, which is an immunostimulant, but we don't have directly immune therapies. So there's a new hope with calreticulin mutation that, as you know, is the mutant calreticulin protein is expressed on the surface of MPN cells that have the mutation and can be a neoantigen that can be targeted by antibodies or by the immune system. And in fact, preliminary results have been presented during the last EHA meeting by our colleagues from Denmark, showing that you can induce an immunity by vaccinating your patients with calreticulin mutation, allowing for the immune system to recognize the cells that have this abnormal protein on their surface and maybe eliminate them. For the moment, they could just show that the immunization was acquired after vaccination, but there was no, until now, clinical response in terms of normalization of blood counts, etc. So they are investigating why there's this discrepancy between the activation of the immune system, but yet no clinical response.